I was born in the 80s. And so I was the first wave of generation that could access the technology for it to be useful. In 2015, I was 33 years old and decided to take the leap of freezing my eggs for the first time. I was able to successfully freeze 17 eggs. For my 35th birthday, I froze again and got an additional 12 eggs, which is great. That was a great outcome. The third time I decided to freeze my eggs was 2 years after that. But a year before I froze my eggs, I decided to make myself a guinea pig, and I started using fertility focused vitamins. I made smoothies every day, and I really focused on my physical health. Being almost 37 years old, I was able to collect 32 eggs. So I ended up with 61. I've put them in long-term storage, but even today at 40 years old, I haven't used those eggs yet.
Hello and welcome to Cure Talks. Today we are discussing the nuances of egg freezing, the hopes and uncertainties around it, and all you should know if you are planning to opt for the procedure. I'm Shweta Mishra, and I'm honored and excited to have Dr. Carolyn Alexander join us again on Cure Talks from Southern California Reproductive Center. Dr. Alexander is an expert in egg freezing and infertility treatments, and also work closely with oncologists on fertility preservation of our patients who are about to undergo chemotherapy. Joining Dr. Alexander on the panel is Valerie Landis, who has been working in the field, women's healthcare field, for more than a decade now, and she speaks openly about her personal egg freezing experience. Welcome to Cure Talks, Dr. Alexander and Valerie. It's a pleasure to have you both on the panel today.
It's an honor to be here. Thank you.
Thank you. Dr. Alexander, the egg freezing procedure was developed in 1980s, and it was originally developed to help people going through serious medical conditions and treatments like chemotherapy that harms their fertility, and it would help them improve their chances of starting a family post-treatment. But in the recent years, statistics tells us that more and more women from a broader group are choosing and exploring egg freezing options, and this field has gotten quite a makeover now. So I wanted to start by asking, what is the most common reason in your experience, or if a study has been done on that, that women are citing to choose to freeze their eggs?
That's a great question. I know for myself, I wish I had frozen my eggs, but my generation, I'm near 50, wasn't considered from the American Society of Reproductive Medicine to be a standard of care to offer egg freezing due to advanced maternal age necessarily at the time. In general, the most common reason that clinically in Los Angeles that we talk to patients about egg freezing, the biggest reason I see is the OBGYN checks their AMH or their day 3 FSH, and it's borderline or right at a confusingly low level, and patients aren't ready to start a family, and they think to themselves, should I think to freeze my eggs? Another common reason is, as we get into our 30s, everyone is realizing that by 35, the chromosomes in the egg start to change. And so there's more of an open discussion. People on social media are talking about thinking about egg freezing. Even at the Midwest Fertility Society meeting, which was, I think, this past week, I saw notes from my friend who attended where they said actually they're going to be talking about egg freezing by 30 as a discussion point, which is interesting because sometimes when we see patients at 29 or early 30s, we say, well, let's reevaluate. You could trend your AMH, discuss it. And occasionally it'll change to be concerning over a year. And we don't understand why nature is doing that, other than as time goes by, age affects our egg supply and egg quality, as well as environmental pollutants, plastic, and endocrine disruptors from our makeup and phthalates and things like that too.
Okay, very interesting to know that, doctor. And that brings me to the question about the success of the procedure. So could you talk a bit about the factors on which the success rate of egg freezing depends?
That's a really good question. I always think of cases where the patients didn't have too many eggs frozen, but they got a healthy baby many years later. Especially with our cancer patients, sometimes we have to we don't have time on our side to let them try vitamins, acupuncture, weight loss if they're overweight. Think about vitamins and proper nutrition and acai berry. There's a lot of prep we do for our patients who have the breather of time to think about egg freezing. It's our cancer patients, we're in a time crunch. But what we realize is that the eggs can survive the thaw 87% or up to into the 90s percent. Mm-hmm. Since vitrification, which is flash freezing the eggs do survive. Around 9 out of 10 of them survive the thaw. I think the challenge is, especially since COVID hit, the sperm parameters have become harder. Men are vaping more, using CBD oil. Obesity's on the rise with some of the men, sedentary lifestyle, more binge drinking. And so we've become more vigilant that before we ever thaw the eggs, for 8 weeks, the men should be on a strict regimen, because we've had it happen where we thaw 10 eggs and lo and behold, that morning, the sperm looks really concerning, the motility suboptimal, even though a month prior or two, he had a normal semen analysis. And potentially the sperm DNA fragmentation goes up with toxins, as well as, fried food and processed foods, as well as a high body mass index, and as well as COVID. So even asymptomatic COVID may transiently affect the sperm DNA parameters. And I just was reading an article this morning about how environmental air pollution, like if you live near a freeway or, particulate matter that can be from the air, that sperm DNA fragmentation is compromised too. Vitamin D has been shown to improve sperm quality as well. But when people tell me, how are my eggs going to do when I want to get pregnant? Well, I always say half the battle is the sperm. And that's why I took a moment to talk about that. Right. They survive the thaw, but then they have to fertilize. And then the genetics of the eggs depends on the woman's age. And so that's where the odds are that around age 35, it takes 15 to 20 eggs to get a pregnancy. And so as we get older, it takes more eggs for us to get a chance for a pregnancy, because it may or may not survive the thaw. They may or may not fertilize, and they may or may not be genetically normal.
That's right. So yeah, thank you for pointing that out. It's not only the egg parameters, the sperm quality matters a lot, right, in the success rate. So thank you for pointing that out. And but given all of that, we know there are a lot of factors that are deciding the success of egg freezing, and the procedure is not without its nuances. It doesn't guarantee a pregnancy, right? And as the ethics committee of the American Society of Reproductive Medicine highlights, providers should ensure that women who request egg freezing should be informed about the efficacy, safety, their benefits, and risks involved in this process. So could you share a bit about how you approach your patients about egg freezing? How do you explain the procedure to them and the risks involved or the benefits?
Yeah. Every month we ovulate one egg if you're having regular menstrual cycles. And what's fascinating about the ovaries is that you have a pool of follicles in each of your ovaries, and that can range each month. Some months we have 5 to 10 on each ovary. Some months we have 3. It can vary. On the third day of your period, FSH, follicle stimulating hormone level, which is from your pituitary gland, if that level is over 10, that's a red flag that there is diminished ovarian reserve. So it might be harder for us to get a quality and quantity egg supply for that individual. And so occasionally we'll have a discussion about some eggs and some embryos, even if they don't have a current partner. It's still really important to take a step back, take a breath, and realize that ultimately for a biological baby, for yourself, you would need potentially an embryo, which is a much stronger chance of a future pregnancy than the plain egg that again may or may not survive the thaw, fertilize, or become an embryo that's healthy, and then it has to implant. The other thing that I talk about is during the 2-week process of the injections to grow your eggs, you may feel breast tenderness, headache, mood swings, bloating, and the most common cause constipation. So it's important to avoid constipation. In the prep time before you take the injections, we encourage vitamins, acupuncture, get your body exercising, be as healthy and fit as you possibly can. We check your thyroid level, vitamin D level. We check for anemia. We want to make sure everybody's pap smear and breast exam is evaluated. If she's 40, we talk about mammograms. If you have a family history of breast cancer, you may be encouraged to have a mammogram younger than 40 years old. If you're also have any health conditions, such as rheumatoid arthritis, multiple sclerosis, lupus, anything like that, we like to have a chit chat with your primary care doctor and your doctor, make sure they understand your estrogen is going to go up, which puts us at risk of a blood clot, such as a deep vein thrombosis or pulmonary embolism. And even though it's extremely rare to ever see that, it's always sort of in the back of our mind as the doctor of do no harm, because we're trying to help you achieve your goal of having some eggs frozen for your future. You may or may never need these eggs, but if you need them, we want them to be the best quality and quantity that we can get. People always say, I want more eggs. Well, I want you to get more eggs too, but the blood flow to your ovaries has a lot to do with your blood pressure, cardiovascular health, whether your cortisol is high and you're extremely amped up and stressed and not sleeping. Perhaps the body's like, why should I try to ovulate this month? It's forget about it. That's the least of my worries from your mechanics of your body. Your body's in a fight or flight mode from stress. So in terms of preparing yourself, you really want to have a good support system. Lately, I've been really almost writing in my note, who's their support system. Some patients say, I don't really want to talk about it with anybody. It's very personal, and I understand, but it's really important to have one good friend or a cousin or someone to air it out, your fears and your hopes and why you're even doing this. Because if you don't have a person to chat with, I can chat with you, but it's still hard. You need another outside person that's guiding you and giving you support. The night the eggs come out, is you just have to focus your energy on healing. Sometimes patients say, I wish this, I wish that. Everybody wanted you to get the most eggs possible and the best quality, but you have to just focus that you accomplished the goal to get as many as you could. And you did the best you could, because some people do the retrospective look, and you asked a really good question, Shweta, which is the trigger shot, which is the final moment where the eggs are going to loosen up from the sidewall and for the egg retrieval to safely get those eggs. That can play a big role in whether or not we get the quantity we were hoping for. And absorption of that shot, as well as the timing, and as well as staying hydrated and keeping your metabolism healthy with normal bowel movements, that'll help us get the system to work.
Right. Thank you. Thank you. All these very important facts that you shared, Doctor. And is there also a discussion about success rate and how do you handle that?
Yes. So a lot of people say, how many eggs do I need for the future? Are they going to survive the thaw? I always go over the statistics in detail and their age-related chance of chromosome abnormalities. I always explain that there is no guarantee. I tend to write that too. Is this, I wish there was a guarantee, but there's no guarantee. And then we prepare in the future if they need it, that the sperm's optimized as much as possible. And, you know, our average age of patients is into their later 30s here. So we're used to telling patients that you might need a lot of eggs to get a chance for a future pregnancy. And so it's challenging. I have graphs I can show people at 39 and older. I did see from a European study that egg freezing after 38 is kind of an interesting discussion, but we do see a lot of patients who haven't met the right partner. They realize they want this as an option, and it is a 5-year retrospective look for us. At 37, it took 17 to 20 eggs to get a pregnancy. So at 39, we need 25 or more, even a higher number, to get a chance for a pregnancy. And that is a little bit challenging because some of those patients, their egg supply, AMH level, is low and their follicle count isn't high. And so it's a little overwhelming to think, how many tries do I need to get enough eggs for the future? So what I tend to say is, let's focus on one good try, see what we can get, and at least have that as an option. And we can pivot from there and talk about the future from there.
Right. Thank you. Thank you for sharing that, doctor. And it's really so important for folks to know their best optimal time when they can conceive with minimum efforts. And all this guidance from providers like you is so important, because, you know, nothing is less confusing about this. That's all I know. So thank you for that. And I was just talking to Valerie about it, and I know she has some great questions for you, doctor. So I will pass it over to her now. And Valerie, welcome to the show again. And it'd be great if you can, you know, before you go on to ask your questions, please share your egg freezing journey a bit with us.
Well, I feel really fortunate that I worked in the area of fertility and women's health, because it really taught me about my own fertility. It wasn't something that I learned in school or from my friends. Very much like you were sharing, Dr. Alexander, that the window of women before me really taking advantage of egg freezing. I was born in the 1980s. And so I was kind of like the first wave of generation that could access the technology for it to be useful in my age. And so in 2015, I was 33 years old and decided to take the leap of freezing my eggs for the first time. I was able to successfully freeze 17 eggs. Now, I'm always kind of reluctant when I talk about how many eggs I froze, because I realize out there, there's a lot of comparison going on, and egg envy, so to speak. And I knew I was going to do this multiple times, but I wanted to see what would happen the first time I embarked on it. And it's a learning experience, right? Not only just of how you feel during the procedure, but also, you know, what you learn from that egg freezing cycle. And so I waited 2 years and I decided to freeze again to increase my opportunities for how many children I would want in the future, and bring the best outcome possible. So for my 35th birthday, I froze again and got an additional 12 eggs, which is great. That was a great outcome. I had a totally different experience on the meds this time, where I was severely bloated and had a hard time recovering from my trigger shot, I do believe, because it was a different med order than I had the first time around, because we were trying to shape things up, maybe get a little bit more, but I was 2 years older. The third time I decided to freeze my eggs was 2 years after that. But a year before I froze my eggs, I decided to make myself a guinea pig, and I started using fertility focused vitamins. I made smoothies every day, and I really focused on my physical health. And so in a off chance, or just even how we did our med protocol, being older, being almost 37 years old, I was able to collect 32 eggs. Now, I can't contribute why that happened. I may be a candidate for PCOS. So they're not all those eggs might be really great viable eggs, but they were a mature level 2 egg. So we were able to freeze them. So I ended up with 61. I've put them in long-term storage for my financial, future of family planning. But even today at 40 years old, I haven't used those eggs yet, which is pretty common in the space. And so maybe someday I will. I was really hoping to find the right partner and do that as a team. Obviously the sperm's important, and I didn't feel like at this time period that I wanted to make any of those eggs embryos, whether with a donor sperm or a partner. And so therefore I'm in this holding pattern until something else shifts. But as we're talking about this topic, I know a lot of patients think about, maybe you could help answer, Dr. Alexander, what is the perfect age if we had to pick an age to freeze our eggs? And when is too old? And is there like a time limit we should just give up on that factor?
Yeah, that's a good question. It is always going to be younger is better, but then what young age is ideal. So that's why a lot of the OBGYNs are checking an AMH level, anti-Müllerian hormone level, as well as a day 3 FSH, estradiol, and LH level. And if an individual is on the birth control pill for many, many years, sometimes the anti-Müllerian hormone level can be suppressed. So don't get alarmed if you checked it with your OBGYN and the level's so-so. But generally speaking, we're encouraging women to freeze eggs between 30 to 34, because at 35, the mitotic spindle of the egg starts to get sticky, and that's where chromosome problems can pop up. And so if you had the opportunity or were thinking about it and you're not ready to start a family in the next year or two, it could be good before 35 to consider egg freezing. Our ethics committee here, when we were meeting to talk about eggs, when we get into our 40s, we have a really big heart-to-heart with all the patients about an embryo versus an egg. But if they're not ready to, don't have a partner or don't want to pick a donor sperm, then we'll have a discussion about the risks of egg freezing and the unknown factor of the genetics, because then 1 in 4 to 1 in 5 of the eggs has a healthy genetic complement. And so it takes a lot of eggs. And so that's the hard reality when we get into our 40s. It's not that we can't freeze eggs, we do, and we do it, but we talk about it and have a big discussion about how an embryo is better than an egg at that point.
Mm-hmm. Yeah, and that brings me to my next question. I mean, since COVID, I froze all before COVID. So my last cycle was in 2019, but is there an ideal number of eggs that for each live birth that they should try to shoot for? Or is it a combination of their AMH and their physical health and some of their ovary reserve?
Yeah. That's a good question. Generally, at under 35, we say 15 to 20 because it takes that many to hit the blessing of one pregnancy by 85 to 90%. So it is a little confusing. The ASRM, American Society of Reproductive Medicine, tells us that each egg has a 4 to 12% chance of pregnancy. So some people use that as a guide. And try to err to the higher side of getting a good quantity. I can think of many patients over 17 years of doing this job that had a few eggs and got a pregnancy down when they met the right partner. And then I can think of people who had a lot of eggs and didn't necessarily get a pregnancy. And so it was kind of a little bit of a wake-up call too for all of us that it isn't always, perfect, but we're trying to improve each step, especially now again with the male factor part of it.
Mm-hmm. Yeah, and that seems to be a more focused area that we're concentrating that maybe had been neglected in the past. What about, let's talk through, a typical protocol for your patients, or just the physical stages of going through an egg freezing cycle and each of the timeline that one would expect. they're going through an egg freezing cycle?
Sure. So there's typically around 5 different ways of protocols, and 3 of the protocols need birth control pills. Some patients have never taken birth control pills, or they have chronic hypertension or migraines or a contraindication to birth control pills. So we have many ways and tricks we can do to prevent needing a birth control pill, but some patients benefit from synchronizing the cohort or group of eggs with birth control pills. During the injections, it's around 10 to 12 days of injections called FSH or FSH with LH. And sometimes we'll add growth hormone as well as a Lupron protocol, depending on what your circumstances are. There's an important shot called a GnRH antagonist with protocols that are called antagonist protocols, and that tells your brain not to ovulate. Then on average, 90% of people need 11 days of shots to get the eggs to mature. Some people by day 9, the follicles are a perfect size and they're ready to go, and some patients take longer. If you've been on the birth control pill for years and years and years, sometimes it's important to think about taking a breather month from the pill, but you have to be careful for contraception because you're used to being on the pill for so long that being off of it, you could get pregnant. And then the egg retrieval is around 35 to 36 hours after the trigger shot. That's a 15 to 20 minute procedure where we carefully get the eggs out, and the eggs are flash frozen with vitrification. The week after the eggs come out, I always say, be ready for a heating pad, Tylenol. We try to avoid aspirin or NSAIDs, so it's important to just hang in there. It takes about 7 days to feel better.
Mm-hmm. Well, that very much echoes my experience, and the bloating is very real after egg freezing. And it's surprising how different each egg cycle can be, each freeze can be from each other, even when you've experienced it before. Let's talk about some of the advantages and disadvantages. You mentioned, embryo freezing or creating embryos from frozen eggs or fresh before you go into that whole process for better outcomes. Maybe give a little bit of pluses and negatives, or advantages and disadvantages of having embryos versus eggs.
Yeah, so the embryo is a fertilized egg that's grown over 5 to 7 days to a blastocyst, which has about 100 cells. And it has an inner cell mass and a trophectoderm, and so that has a much higher probability of surviving the thaw. 99.6% of hatching blasts survive the thaw. And so that's a little different than 87 to 92% to survive the thaw. The other thing about an embryo is it can get graded to good, fair, poor, or A, B, C, as well as the opportunity, depending on your age and your circumstances and your discussion with your doctor, to check genetic testing on the embryo. In a sense, if you knew it was tested by the capabilities of what's called next generation sequencing, that has a higher probability of becoming a pregnancy because it's at least overcome some of the genetic checks. The accuracy of genetic testing and the added confusion with mosaic embryos, where some of the cells are healthy and some are not, and that's been opening up a big discussion for us of how to guide our patients who we love so much. We only want everybody to have a healthy baby from their eggs or their embryos. And so it's a big, and I do put myself in their shoes because I feel it as an older parent myself. And so I understand what everybody's going through. And so it's hard to go over those statistics, and patients, especially when we're talking to them, it's a little bit of information overload. So you're talking about eggs, egg quality, then you suddenly throw in, can you try to figure out a sperm source? It just adds so much to the discussion. So I try to take it step by step and see what their personal questions are in that discussion time.
Yeah, and that's very critical, because once you do make an embryo, you can't unmake the embryo. It has the DNA from both parents. So if you know you're going to use your own eggs, but maybe don't like the parent source of the sperm choice, that can't be undone. So that's a very big decision. It's part of the reason why I didn't make any embryos, is because I wasn't ready for that choice. Let's talk about, is there an expiration date on all this genetic material that we're freezing?
Yeah.
Is there a time limit that it's no longer good, or is it good forever?
Yeah, I was lucky to be on one of the scientific teammates at Cedars-Sinai to look at women over 45 who had eggs or embryos frozen, and looked at that. It is a higher risk of preeclampsia or high blood pressure in pregnancy when we get older, as well as placenta issues. We are improving our protocols for embryo transfers to improve pregnancy outcomes for older parents. I think the hard part is, in the past, we had encouraged patients to use their eggs within 8 years, but we've been blessed. Even one of the pictures right here is one of my embryos from eggs from 12 years ago. And so it was relatively exciting. I know my friends in Italy have eggs from many years ago that they're making pregnancies with. So because it's in a glass-like state and a vitrified state, we're not seeing them deteriorate or the chromosomes change over time or congenital anomalies increase, but it's still typical to talk about within 8 years, but we've had pregnancies from 12-year frozen eggs. Embryos, 20 years because of cancer patients from the 80s and things. I worked at Johns Hopkins Hospital, and we had patients who had embryos from decades prior, and they had pregnancies. So they don't necessarily change over time to our awareness.
Right, because you're freezing at whatever age, and it kind of stops the biological clock at that period of time. What is the oldest age that a woman can technically get pregnant? And is there a window that conceiving that frozen DNA, whether it be creation of your own eggs or an embryo that you froze, is recommended?
Yeah, I mean, so now that even colon cancer screening at 45 is changing, and we're learning more and more, as long as patients are as physically fit as possible at 45, have their mammogram, pap smear up to date, check Cologuard or colonoscopy, and have an annual physical exam with their primary care doctor, and don't have a huge red flag. So a chronic hypertensive patient who has obesity is much harder and riskier to get pregnant at 45 or 50 years old than a patient who's been doing, exercising, Pilates, is at their ideal body weight, doesn't have diabetes. But so chronic health conditions makes it much riskier when we're over 45. But our group at Southern California Reproductive Center help patients into their 50s. But a lot of our patients, again, are relatively fit and as healthy as possible.
So does it have anything correlating with the menstrual cycle and being in menopause? Can you technically get frozen embryos in a pregnant?
We have women in their early 20s who have premature ovarian insufficiency, and we're still able to get them pregnant with medications. So some patients call in their mid 40s and they're like, I stopped having my period a year ago. Am I still a candidate to consider fertility treatments? You can carry the pregnancy as long as the uterine environment is healthy, even if you're not getting your period. But when we don't get our period as women, you risk osteoporosis risk and cardiovascular risk. And so you always want to talk to your doctor if you're not getting your period regularly.
So that's the real advantage of egg freezing, is that you can get pregnant at a later age because you froze your DNA when you were younger.
Absolutely. Thank you. Thanks, Valerie. Thanks, Dr. Alexander. Great listening to you both and learning all the facts that you shared in your discussion, especially the shelf life of eggs and embryos. Wow, 20 years. That's something. Yeah, thank you so much for all this discussion. And it's time to wrap up the show now. So thank you, Dr. Alexander. Thank you, Valerie, for your very insightful questions and guiding the panel. We'll make this talk available very soon on curetalks.com. So until next time we meet, thank you everyone and have a great day.